Good evening. This is Dash Kapadia, and today we will be interviewing Mr. Nimish Shah. So, Mr. Shah, why don't you introduce a bit about yourself?
Yeah, hi, thanks for having me here. My name is Nimish. I'm a doctor. I'm a practicing pulmonologist, mainly out of two hospitals, which are Sir H.N. Reliance Foundation Hospital and Just Hospital. My day-to-day job involves looking after patients with respiratory ailments, but you can't really delineate other parts of the body. So we look after patients on the whole, but predominantly I focus on patients with respiratory illnesses. Since I'm in a hospital-based setting, there's a lot that goes on in the hospital, and I'll take on your questions as we go through.
Alright, thank you. So, for my first question, what is your definition of safety?
Basic safety is feeling safe and secure in your workplace or work environment or outside. And that's what we all aim to ascertain in our workplaces, especially.
Yeah. So, what according to you is a safety ideal in your line of work as a pulmonologist?
So I think basically in a hospital-based setting, I think there are three aspects of safety that we look at. One is patient safety in terms of how do we protect the patient from harm, and harm could mean medication errors, doctors' errors, nursing errors. Yeah, so all of this. Second would be safety of hospital staff, which includes ancillary staff, along with doctors, nurses, and administrative workers.
Hmm.
And thirdly, would be overall safety in terms of fire, any natural disasters, calamities, like a terrorist outbreak or a bomb scare, etc. So I think if I split these up into three, I can go through one each one after the other. So if I begin with patient safety, so I think that's one of the toughest and the most important that we aim to achieve, and when we look after patients in the hospital, a lot of you'll be surprised to know, but a lot of our safety mechanisms have come from lessons that we have learned from the aviation industry.
Hmm. Aviation. That's interesting.
Yeah, so the aviation has been, aviation obviously is the highest risk
Yeah.
professions in the world. And, whenever there were extreme cases of patient safety, we have taken up lessons from the aviation sector. So simple things like, you write up a medication, you want to make sure that the right medication is given. So simple things like writing up, if you're doing manual paper charts where you write up medication orders, so writing bold capitals as opposed to cursive writing. Don't write trade names, write generic names. When you write it up, the nurse administers the medication, so it's always double checked and cross checked.
Hmm.
One of the biggest hazards that one would face in a hospital is transfusion related problems. So
Yeah.
now there is a triple barrier for safety checks before you administer any form of blood product to a patient. So that has definitely taken up in a big way. Um, Secondly is safety of hospital staff. And I think every hospital now has a set protocol. And I've got a couple of examples for you. So every hospital has codes, and these codes are not specific to patient safety or staff safety, but they have just been outlined as national requirements. Where if there is an emergency in the hospital, you shout out a code or ring the number, and that's when immediate
Hmm.
action is taken. So, for example, code red would mean it's a fire emergency. Code pink would be child abduction. Code yellow would be either an internal or an external disaster. Code violet is physical violence or an aggressive mob who's come to attack the hospital. Code black is a bomb threat. Code orange is when hazardous material has been spilt on the floor. And you don't want it, like it may be a blood product,
Hmm.
blood itself, or it may be a bit of acid which has been used probably clean or sterilize something. Yeah. And code green is evacuation code. So these are the common codes that we look into.
Okay,
So
yeah.
these codes probably just summarize up all of our safety measures.
So
Yeah.
yeah,
And
people.
lastly is obviously
Exactly.
in terms of safety, in terms of non-patient, medical or medical staff safety. So that would basically means like a bomb scare or a fire. So knowing, so we do routine fire drills. We have mock cardiac arrest codes. So all of this is done on a routine basis to make sure that people working in the hospital know where the fire exits are. So if they need to escort a patient or a visitor out, they know where they're going. There are fire safety staircases. There are refuge floors. So all of this is something that we look seriously into,
Hmm.
and we implement. And there's also routine drills that happen to make sure that everybody is well aware. Most importantly is your basic life support skill, which should be a mandate for every healthcare worker, and it is. So all of us are at least basic life support skill trained. So if
Yeah.
somebody were to collapse in front of us, we can easily start resuscitation till some more help comes through, so that at least there's a chance to save the patient's life.
Hmm. All right. So like this, you can absolutely ensure the safety of your patients and your co-workers.
Correct.
It's very elaborate, yeah. It has to be quite spontaneous decision making. So, how would you suggest that maybe an industrial worker could keep himself safe in a toxic environment when it comes to the respiratory system?
Correct. So I think again, so in terms of, so I'll tell you in general, then I'll talk about respiratory as well. So when it comes to hazardous products in the hospital, right? So we have a color coded system for waste disposal. So that again
Hmm.
is a very important part of our safety protocol. So we have black bins, we have yellow bins, and we have red bins. And then we have what you call as a sharps bin. So anything sharp like a needle or
Yeah.
a scalpel or a blade or a stitch cutter that we use, all of that goes into the sharps bin, which is like a solid thick plastic bin where it cannot penetrate through. So earlier everything used to go into plastic bags, and the poor guys who used to clean up after us, a lot of them used to get needle stick injuries.
Hmm.
They're very high chance of contracting infections like hepatitis and HIV. Yeah, because all of these were not sterilized waste.
Yeah.
So now we have a good color coded system. So even for blood products, like, so if you're removing fluid from a person's chest or from the abdomen, yeah, so there is a sluice where you would dispose of body fluids. So all of that is very systematically done, and every hospital is mandated. So any hospital which is accredited by the national body will have these color coding systems which have been implemented and followed.
Hmm.
Now, in terms of toxic substances for the respiratory system, so in the workplace is generally not so much of a problem, but in more of industrial areas, it's a big problem because the West has adapted to human resources and medical resources very well. Ergonomics, where if you have say a factory which is producing asbestos, right, which is making asbestos sheets or cladding, they make sure that asbestos is banned in pretty much all of the West. It's only available in Asia now, and so they use proper protective equipment because we know asbestos causes cancer of the lining of the
Yeah.
lungs, mesothelioma. Yeah. So basically, knowing what you're exposing your workers to in terms of dust, fumes, physical waste like chemicals, irritants, and providing the workers with proper protective equipment, especially when you have toxic fumes exposure. So making sure they wear the right type of mask so that they don't get exposed to these fumes, because occupational asthma is a very big problem. It is not so much so well defined in, unfortunately, our country, but
Hmm.
in the West, it's a very well defined problem. And I mean, this is secondary, but there's a lot of compensation that can come through. If you prove that adequate measures were not taken and you developed occupational asthma.
Yeah.
Yeah. So, and then again, so if you talk about areas like Devnar, where there is a lot of garbage burning, so there's absolutely no precautions taken on that front. So sort of sensible and responsible waste burning in a eco-friendly manner, again, very important. Not encourage. So I think one of the biggest boons that we've had is worldwide indoor smoking in public areas has been banned, and I think that's one of the best decisions that all the countries in the world have unanimously
Yeah.
taken, because passive smoking is a big hazard. Passive smoking with hookah is even worse.
Mm.
Yeah. Yeah, vapes are the new problems that we face. And again, so all of these are not good. And I think having enforcements, having laws against them is very important.
Mm. On the topic of vapes, would you say a vape is safer alternative to smoking that could maybe help you stop smoking, or is it still just as bad?
No,
It's still just as bad.
it's as bad. Yeah, it's lesser of the two evils, but
Hmm.
it's as bad.
It's still as
And in
bad.
fact, there is a terminology called in the respiratory world called VALI, vape-induced acute lung injury. It's a very well-defined term, and we've seen cases in and out where people have had lung injury because of vapes, and sometimes these can be permanent.
Yeah. So even if it's the lesser of two evils, it's still just very bad.
Yeah.
Yeah. So what do you feel is the biggest threat to a person's health when it comes to the respiratory system, or even the health in general?
So yeah, so I mean, see, the respiratory system in general has a lot of triggers which can cause problems in the lung. So
Hmm.
like pigeon feathers and pigeon droppings, mold is known to cause what you call as hypersensitivity pneumonitis. It's a condition where your lungs start getting scarred, they start stiffening up, then you can't get enough oxygen, and eventually it's a miserable death that the patient dies. So there are a lot of triggers and factors. Unfortunately, we can't finish all of them in this
Yeah.
session today. But in general, I think keeping a nice, clean environment in and around you, avoiding irritants or toxic substances like smoke, illicit drugs. So I've not mentioned about people having hash, people having
Hmm.
other illicit drugs. So
Yeah.
those are an even bigger problem.
Hmm.
Cocaine is a very big problem. Yeah. So all of this, so staying away, staying clear from all of these, and in an industrial setting, making sure that we look after our workers, give them proper protective equipment. This is probably the way forward.
Yeah. Yeah. So we must ensure that the workers are safe themselves. Yeah.
Correct.
All right. Thank you so much for having this interview with me, Mr. Shah. And yeah.
Okay. Thank you. Thank you for having me.